Welcome back, our fans. Endocrine disorders. Endocrine glands are organs that secrete chemical messengers, hormones, directly in the bloodstream to regulate the functions of distant organs and systems. The functions of endocrine glands are regulated by positive and negative feedbacks, circadian rhythms, and other direct factors. Endocrine glands discussed. 1. Pituitary gland. 2. Thyroid gland. 3. Parathyroid glands. 4. Adrenal glands. 5. Islets of Langerhans, diabetes mellitus. 6. Ovaries, pregnancy. 1. Pituitary gland. It is seated in the sella turcica. It is called master gland with the hypothalamus because it secretes hormones that regulate most of other endocrine glands. The anterior lobe secretes A. Growth hormone, GH. B. Thyroid stimulating hormone, TSH. C. Adrenocorticotropic hormone, ACTH. D. Follicle stimulating hormone, FSH. E. Luteinizing hormone, LH. F. Prolactin hormone. Growth hormone regulation. GHRH is secreted by the hypothalamus to stimulate GH secretion from the pituitary. Then, GH stimulates the liver to secrete IGF-1. IGF-1 acts on bones, cartilages, and soft tissues to stimulate their growth. When the level of IGF-1 is elevated in blood, it acts as a negative feedback on the pituitary gland to stop further GH secretion. A. Hypopituitarism, dwarfism. It is caused by deficiency of one or more of the pituitary hormones. A. Growth hormone, causing impaired growth and obesity. B. TSH, hypothyroidism and mood changes. C. ACTH, weakness, weight loss and hypotension. D. FSH and LH, infertility and hypogonadism. E. Prolactin, failure of lactation. Oral manifestations and considerations of hypopituitarism. 1. Small mandible. 2. Microdontia, if occurred before dentinogenesis. 3. Delayed and incomplete eruption. 4. Teeth crowding and malocclusion. So, early orthodontic treatment should be performed. 5. Salivary hypofunction, causing higher risk of caries and periodontal disease. So, the patient should perform frequent periodontal recall. And fluoride supplements and diet control should be considered. For pediatric patients. Dental management. 1. Patients are at risk of adrenal crisis and hypopituitary coma. These emergencies are caused by low blood levels of cortisol and thyroid hormones. They cause severe and sudden hypotension and hypoglycemia leading O. Loss of consciousness. They are precipitated by GA, sedation, stress and infection. A. So, these factors should be avoided. B. If a pituitary coma occurred on the dental chair, it must be managed by I. 200 mg hydrocortisone sodium hemisuccinate 4. 2. Oxygen. 3. Call for medical assistance. 2. The patient may be on regular corticosteroid therapy. B. Hyperpituitarism. Higher levels of GH causes higher blood levels of IGF-1. This causes exaggerated growth of soft tissue and bone. A. Gigantism. When the increase in GH levels occur before puberty, before epiphyseal closure, manifests as well-proportioned giant individual. And teeth spacing. B. Acromegaly. When the increase in GH levels occur after puberty, after epiphyseal closure, manifests as O. Increase in thickness of bone, by subperiosteal bone deposition. Not height. O. Enlargement of all soft tissues and viscera. General manifestations of acromegaly. 1. Prominent supraorbital ridges. 2. Broad nose. 3. Large hands and feet, spade-like hands. 4. Paresthesia in fingers due to carpal tunnel syndrome. 5. Diseases caused by organ enlargement. A. Diabetes mellitus. B. Hypertension. C. Cardiomyopathy. 6. Local effects of pituitary tumor. A. Headache, due to increased intracranial tension. B. Visual field defect due to pressure on optic chiasm. Oral manifestations of acromegaly. 1. Apical hypersegmentosis, so, hard tooth extraction procedures are expected. 2. Continuously enlarging soft tissues of the lips, thick lips, and tongue. Macroglossia. 3. Salivary glands enlargement. 4. Protruded mandible, prognathism, leading to A. Class 3 occlusion. B. Teeth spacing. C. Sudden ill-fitting of dentures. Progressive periodontal disease may be caused by dental malposition and tissue enlargement. All these oral and facial manifestations allow the dentist to be the first to spot the disease. Dental management of patient with acromegaly. 1. Dental procedures may be complicated by systemic condition. A. Diabetes mellitus. B. Hypertension. C. Cardiomyopathy. 2. The supine position should be avoided and GA also should be avoided due to risk of respiratory hazards due to A. Macroglossia. B. Hypertrophic larynx equals narrow opening of epiglottis. C. Goiter. D. Kyphosis. 3. The patient may have difficulty brushing due to carpal tunnel syndrome and macroglossia. So, electric toothbrush is preferred. Thanks for watching. Support us by likes and subscribes.